Hi, this is Colin Hung with Healthcare IT Today, and I'm joined today by Nanne Finis from Kronos. Nan, welcome to the program.
Thank you so much.
And Nan,
Nice
you're coming to us from Chicago, where it seems to be very, very bright and sunny.
It is bright and sunny today. Tomorrow is rain, but today is bright and sunny. It's a welcome day.
Awesome. Awesome. So, Nan, I'm really looking forward to diving into a topic with you, which is all around workforce management, which of course is what Kronos is well known for. But specifically, because this is being recorded during Nurses Week, or shortly after, I want to talk to you specifically about what the impact has been on nurses specifically of poor workforce management. Meaning, I hear that some organizations are attempting to manage nurses using an Excel spreadsheet.
Well, we do see Excel spreadsheets in use today out there. And, I think this whole experience that we've been through over the last couple of months has pointed out very clearly the importance of workforce management and workforce management in a thoughtful, planned way. So, some of the challenges with the paper and pencil and even a spreadsheet really often result in poor staffing mix, or staff not being the right staff for the right patients, or numbers of staff in one area versus another that might not meet the needs for the census or capacity that's presenting. So, I think that manual process, given the complexity of our world anymore, in healthcare, particularly as you pointed out in the last several weeks, really the opportunity to automate this and provide visibility for staff, is needed, is very much needed.
Now, Nan, you're speaking from a place of expertise because you yourself are a nurse and you are the chief nursing officer at Kronos. So you definitely have seen some things. Would you be able to share maybe a story, without naming names, of when nurse scheduling goes wrong?
Sure. Now, I think there's probably a lot of examples of that. But what I'll do is I'll just kind of frame what might go wrong in an organization, and we see this kind of challenge in every organization. But again, if you think about staffing and scheduling, the schedule is a plan, is the plan for the most ideal situation, anticipated situation when it comes to census. So particularly nursing schedules are done with that realm. This is the census we're expecting. This is how we're going to schedule. But there's always changes to that, as you know. Either fluctuations in a positive way where staff more patients are coming in than expected, or vice versa. So the ideal schedule is to have that right resource for the right patient at the right time, we often say. And to break that down just for a moment, it is really the right skill level of the nurse or support personnel to care for that diagnostic group of that patient. So it's a mix of skills, competencies, abilities, tenure of that staff, looking at the pool of staff that are caring for those patients. So there's a lot of elements to appropriate staffing, and oftentimes when we just schedule to the midnight census, for instance, which is a typical scenario, we're not paying attention or staffing appropriately perhaps to that variation in census, which is so very critical in any given day. So I think those are some of the scenarios we see, and that is where there is opportunity to be more planful, be more thoughtful, have the ability to flex your staffing in a fluid way that then assures that the right staffing levels and resources are there for those patients that need them.
Great. Now, Nan, in a piece that you wrote before, you had mentioned something about a shift from primary nursing
Yeah.
to team nursing. Can you explain
Right.
what that is and what the implication of that is for managing a workforce?
Yes, absolutely. So I don't want to say that there's sort of a drastic shift from primary to team nursing, but it's a concept that I think is presenting itself quite a bit over the last couple of months, and I think is getting much more traction and much more consideration. And that is that the patients we're seeing, certainly with COVID-19, are often very complex, as you know, needing many different resources. And I think it's a fair assumption to say, I have not cared for those patients myself, but in watching and seeing and talking to individuals who have, you know, those patients can't be cared for by a singular nurse. And many patients of the future that come into our front doors, I think will continue to be more complex, perhaps, than we've seen in the past. Those that certainly need hospitalization. So, you know, the whole model, labor models are being looked at now to say, what is that right mix of staff, of resources to care for patients given their clinical situation? And it may be assistive personnel, it may be certified nursing assistants or patient care technicians or licensed practical nurses, or looking at a team of other professional disciplines like respiratory therapists or pharmacists, where not only is care sort of designated across that care team, perhaps even delegated by the nurse, but those resources share the responsibility for the care of that patient, so that you know, because the care is so complex, nursing really is in that primary role to be that critical advocate and leader for that care setting or that care team, if you will. So I think we're going to see more and more of that type of care modeling. How do we do that so that there is support for all aspects of the care delivery and really supports the quality outcomes that we're trying to achieve with these patients?
And since you talk to so many organizations and you deal with so many nurses in your role at Kronos, what gets you excited about the future of nursing? What are you seeing that's got you, you know, really excited about it?
Yeah, I am really excited about many things. Hard to sort of see through the current dynamic, but I think I'm an optimistic person and you know, tend to do that. I've been a nurse for many decades, and you know, I think seeing nurses in action over the last several months, hearing their stories, seeing the care settings and the care providers that are working alongside of nurses, knowing that we are the most trusted care professional, you know, in the industry, we have an opportunity to do so much in the future. You know, I think we are a profession that, and coming off Nurses Week, as you said, is a prime time to sort of reflect on. We are the profession that blends art and science, and that art of nursing is that listening, compassion, support to the family and patient during very trying times. And so when you see nurses today getting the visibility that is so well deserved and has been needed, frankly, the future is in our hands. As patient complexity increases, as care models, as I said, are going to be shifting and sort of reorienting, the nurse is very central to the care of patients, not only in the hospital setting, but across all care settings. So the future is bright. We have, you know, the scientific framework in our practice to know how to care for patients of all types. And with the support of the healthcare industry, certainly the systems that we work in, I think only good will happen as we continue to think about the profession.
Just want to go back to that piece you wrote. I mean, I really loved that piece. One of the things you mentioned in that was a challenge, and I'll quote it here. The challenge you said was the ability to streamline the allocation or redeployment of skilled labor when and where those individuals are actually most needed.
Yeah.
Can you maybe expand on that? Are you saying that there are enough people, but that the right skilled ones aren't getting to where they need to be? Or are you saying that there's actually a shortage of skilled people, but it's hidden because we just really don't have an idea what's going on within that organization?
Yeah. So, I ponder about this issue, and some of us were talking recently and asking ourselves, is there truly a shortage of nurses today? As we think about care today and care tomorrow, certainly pre-COVID-19, the data was there. Those data showed regional variability in the availability of nurses, particularly in rural settings. So there's a great variability as to the resource availability of nurses and assistive personnel. So given that context, we're in a very different place now. We have brought nurses back from retirement. Nurses who are going to retire have prolonged their stay in the profession. Likewise, some have left. So I think there's probably the jury is out, if you will, on what is the state of current nursing resources. So what's happened over the last several years, really the last couple of years particularly, is as healthcare has begun to morph in a significant way, as healthcare is being delivered in many more out of hospital locations, the Walgreens and the CVS's, and in industry settings, perhaps schools and all of the places that nurses practice. And often with ambulatory settings where there's a shift perspective and perhaps no night shift, no evening shifts, and no weekends, and even for our assistive personnel, there's perhaps better wages for some in the Walmarts of the world and other settings where they can use other talents that they have. So I think the golden opportunity is to truly have those right resources for the patient at the right time, as you said. And my comment in an earlier article was to streamline that process, meaning let's take that Excel spreadsheet away from the current state. Let's think about how to automate human processes that perhaps don't need decision making, that could be better informed by artificial intelligence, prediction, trending. So what are those attributes that we know we're using today to a good level that we can really exponentially use, bring the humanness to those specific tasks along the way that need our intervention, but leave scheduling and some of that to modeling and other technologies that could perhaps really look at where those patients are coming into, who needs what resource, when they're actually going to need that care, and be more scientific, but also automate those processes that are ready for automation.
Can you maybe expound on that? Because that's an interesting concept. What you're talking about is just sort of automated scheduler.
Yes.
Like what maybe in sort of layman's terms, what would that automated scheduler be able to do?
Right. So really what the opportunity is that it would automate, the selection of the right resource. So, I'm a nurse, say I'm a critical care nurse, and I have a sets, I'm 3 years in practice and I have all of these certifications to care for this set of patients. So when those set of patients that met my needs or my certifications was needing a resource, I would automatically be identified as a likely, and I'm saying this at a high level, but a likely staff member to support the care for that patient. So, so it's really automating the process of selection of the right resources, whose skill level, obviously, as I said, really matches the needs. But am I available that shift? I don't want to, work 16 hours in a row, nor do labor laws, support that type of staffing, nor is it good for work-life balance or potential outcomes of patients to, work, longer than 16 hours in a period for any length of time except urgencies. So, so embedded in those technologies and our technology would be, what are those practices that your organization really will support? And what kind of shift rotation is acceptable? What is the evidence that you deploy to really look at what is that best practice so that staff are at their best performance level and are not fatigued, are not, that they're working with a team that supports their skill level. So all of that is automated. And if I want to be then flexible and I have something that came up in my personal life tomorrow and I want to a shift to be swapped, I can do that seamlessly and send a message automatically to colleagues that I know could fill my void with similar expertise, and patients would not be impacted. So that's a high level, but that's really at least gives you a glimpse of some of the automation that's available today that many organizations are using.
And I was just going to ask that, is this something that is available today? Is this something that Kronos is working on? What's the status of this kind of automated scheduling?
Yeah, so we do. We have several different scheduling systems, and all with different levels of automation. Our newest Workforce Dimensions product, if you will, has great analytic capability, has that artificial intelligence and prediction, which is augmenting that human touch. So, there is, and we schedule physicians, other clinicians. So we really look at even segments of the workforce that would benefit from automated scheduling. So we do have that. We have trending reports, and not only are we able to look at tomorrow, but so staff can at their mobile devices and their own phones look at their schedule, their benefits, their own capability, and can easily change shifts, capture benefit time, swap and do all sorts of the functions from their own mobile device as well. So so I guess I would say we have automated tasks for the worker, for the frontline manager, and then strategically for other leaders that want to look over time at trend data as well.
Just on that note, I mean, this sounds pretty new, new technology, new capability. What advice would you have for somebody who might want to champion the adoption of this type of solution?
Right. Well, a few things. Automating, so a schedule is so personal to your staff. It is, it's that right balance of what is my plan at work and then what is my plan at home. So certainly before anyone's work life is played with, really think about what you're trying to achieve strategically in an organization. So as I think about sort of automating workforce management in its broadest sense, those organizations that are most successful that we see have oversight, governance, or oversight to the human resource or workforce management world in their organizations. They're looking at what are the metrics they're trying to achieve, what are the efficiencies that perhaps could be gained by workforce management being automated or using technology in that regard. Involving staff themselves in the development and deployment of the scheduling system and all of its components, assignments, and all of that. And there's a lot of nuances in our systems to offer customization so that at the local unit level, the local hospital level, or in the ambulatory setting, for instance, those things that are very particular and important to your organization or a value, whether it's patient complexity or how you look at their acuity and complexity, we can build that in with you, for you, into your system so that those things stay as part of your future technology state.
That sounds really, really awesome. I mean, scheduling and workforce management is definitely one of the technologies that we pegged in a recent episode of our podcast as one of the hot technologies that's going to be going forward, because I think the pandemic has highlighted how, I won't say poorly, but how much better we could be managing the workforces particularly in hospital settings. Whether that's nurses or whether that's cleaning staff, and that now just the need of extra people too, like just to help out. Managing all of that is going to be critical, and I think people are realizing that maybe the old Excel system that they were using is probably not going to handle it.
Yeah, and I would say with this COVID period too, some of the capabilities that we have innate in our system at Kronos is even contact tracing. So when you think about things that can support organizations short-term and long-term, to know who, if someone were positive, unfortunately, that staff would know who was working beside them or who clocked into their given work unit during the period of time that they were working. So, it's the metrics that are available, the data and information, or insights, if you will, that are available through the use of technology are real time and certainly instructive for today's world.
Nanne, if someone wanted to find out more information about Kronos or the automated scheduler that you have, where should they go?
Oh, well, they can call me at any time, and I'll refer them. We now have an organization of 12,000 employees with our new merger with Ultimate. We have great resources. And I think Kronos is one of those organizations where we are here for our customers. We are here for patients ultimately, and there's always people that will be willing to help and get on a phone or another Zoom call and be there to ready to support any need, and that is why we exist. So
awesome. And we'll make sure we put the link in the description of this video, and we'll make sure we put it in the article that this video is attached to. But thank you so much for your time and for being on our program today. You've shared some really great information and truly appreciate it.
Thank you so much. Take care. Good to talk to you.
All right. This is Colin Hung with Healthcare IT Today. Thanks for listening.